Dr. Sarah Mitchell was reviewing patient files when she noticed something impossible. 5 different patients had been treated at different clinics on the same day at the same time. But when she looked at their photos, they all had the exact same face. What I discovered about these identical patients would expose a medical conspiracy so twisted that it challenged everything I thought I knew about identity, memory, and the human mind. I'm Detective James Carter, and in 23 years of investigating fraud cases, I've seen people steal money, steal property, and steal credit. But I'd never encountered someone who stole memories and identities on such a massive scale that they created multiple versions of the same person. The call came from Dr. Sarah Mitchell at Riverside Medical Center on a Wednesday afternoon. She was a psychiatrist who specialized in memory disorders, and she had discovered something in her patient database that made no medical sense. "Detective Carter," she said when I arrived at her office, "I need to report what I believe is a case of medical fraud, but it's unlike anything I've ever seen before." Dr. Mitchell was a woman in her early 40s with the careful, analytical manner of someone who spent her days trying to understand the complexities of the human mind. Her office was filled with medical textbooks, brain scan images, and case studies of patients with various memory conditions. Dr. Mitchell, what kind of fraud are we talking about? She handed me a folder containing 5 patient files. "Detective, look at these photographs." I opened the files and immediately saw what had alarmed her. 5 different patients: Michael Rodriguez, David Thompson, James Wilson, Robert Martinez, and Stephen Clark, all had identical faces in their medical photos. These men all look exactly the same. That's not the strangest part, Detective. According to their medical records, all 5 of these men were treated at different clinics throughout the city on March 15th, between 2 p.m. and 3 p.m. For what conditions? All 5 were seeking treatment for severe memory loss. They claimed to have amnesia following different traumatic accidents, car crashes, falls, workplace injuries. But Detective, it's medically impossible for the same person to be in 5 different locations at the same time. I studied the files more carefully. The patients had different names, addresses, and insurance information, but their faces were absolutely identical. Even more disturbing, their medical histories showed similar patterns of memory loss and confusion. Dr. Mitchell, could these photographs have been mixed up or duplicated by mistake? That's what I thought initially, but I've checked with the other clinics. They all have the same photographs in their systems, taken by their own staff using their own equipment. What about identical twins or other siblings? I considered that possibility, but the facial structure is too exact. These aren't just similar faces, they're identical down to the smallest details. Scars, freckles, even the shape of their pupils. Have you spoken with any of these patients since discovering this? I've tried calling all 5 phone numbers, but they've all been disconnected. The addresses lead to vacant apartments or buildings that have been demolished. This was clearly more than a simple case of medical fraud. Someone had created 5 fictional identities with the same face, and all 5 had sought treatment for memory disorders on the same day. Dr. Mitchell, what kind of treatments did these patients receive? All 5 were prescribed experimental memory therapy using a new technique called neural pathway reconstruction. It's a controversial treatment that's still in clinical trials. What does this treatment involve? It uses a combination of hypnosis, pharmaceutical intervention, and electrical stimulation to help patients recover lost memories. But Detective, it can also be used to implant false memories or erase existing ones. The implications were disturbing. If someone was using medical treatments to manipulate memories, they could potentially control what people remembered about their own lives. Dr. Mitchell, who else has access to this neural pathway reconstruction treatment? Only a few specialists in the city are qualified to administer it. The treatment requires special equipment and certification from the medical board. I need a list of everyone who's authorized to perform this procedure. Dr. Mitchell provided me with the names of 3 doctors: herself, Dr. Marcus Webb at the Neurological Institute, and Dr. Patricia Hansen at the Memory Treatment Center. Dr. Mitchell, have you worked with either Dr. Webb or Dr. Hansen on any cases? I've collaborated with Dr. Webb on several research projects. Dr. Hansen and I have had some professional disagreements about the ethics of memory manipulation therapy. What kind of disagreements? Dr. Hansen believes that in certain cases, it's beneficial to erase traumatic memories completely, even if the patient doesn't consent. I believe that memories, even painful ones, are essential to personal identity. Has Dr. Hansen ever tried to erase memories without consent? I've suspected it, but I've never had proof. Some of her patients have reported feeling like they've lost significant portions of their lives after treatment. I decided to investigate Dr. Patricia Hansen first, since she seemed to have both the means and a controversial approach to memory treatment. The Memory Treatment Center was located in a modern medical building downtown. Dr. Hansen was a woman in her 50s with an unsettling intensity in her eyes, as if she was constantly analyzing everyone she met. Dr. Hansen, I'm investigating a case involving patients with memory disorders. Have you treated anyone recently who was suffering from amnesia following a traumatic accident? Detective, I treat dozens of patients with memory issues every week. Could you be more specific? I showed her the 5 identical patient photographs. Her reaction was immediate and telling. Her face went pale and she gripped the edge of her desk. Do you recognize these patients? These photographs must be some kind of mistake. Patients don't look identical like this. Dr. Hansen, have you ever treated any of these 5 men? I don't recall treating anyone who looks like this. But her body language suggested otherwise. She was clearly nervous and avoiding eye contact. Dr. Hansen, can you tell me about your neural pathway reconstruction program? It's an experimental treatment for severe memory disorders. We use advanced techniques to help patients recover lost memories or cope with traumatic experiences. I understand the treatment can also be used to erase or implant memories. In some cases, yes, but only with proper medical justification and patient consent. Have you ever used the treatment without patient consent? Dr. Hansen's professional mask slipped for a moment. Detective, I think you should speak with my lawyer before asking any more questions. Her refusal to cooperate only increased my suspicions. I decided to investigate her background and patient records more thoroughly. Back at the station, I ran background checks on Dr. Patricia Hansen. What I found was disturbing. 3 years ago, Dr. Hansen had been investigated by the medical board for allegedly conducting unauthorized experiments on patients with severe mental illness. The charges were dropped due to lack of evidence, but several patients had complained that they felt different after treatment, as if portions of their memories had been altered or removed. I also discovered that Dr. Hansen had been receiving substantial research grants from a pharmaceutical company that was developing memory-altering drugs. The company, Neurological Solutions Incorporated, had been pushing for faster approval of experimental treatments. My next step was to interview Dr. Marcus Webb at the Neurological Institute. Dr. Webb was an elderly man in his 70s who had spent his career studying memory disorders. His office was filled with brain models, research papers, and photographs of patients he had helped over the decades. Dr. Webb, I'm investigating a case involving potential medical fraud related to memory treatments. What kind of fraud, detective? I showed him the 5 identical patient photographs. His reaction was completely different from Dr. Hansen's. He studied them carefully with genuine curiosity. These are fascinating, detective. The facial similarity is remarkable, but I don't think these are natural twins or siblings. What do you mean? Look at the subtle differences in aging patterns, muscle tone, and skin texture. These appear to be the same face at different stages of some kind of transformation or modification. Are you suggesting plastic surgery? Possibly, but more likely some form of digital manipulation or identity reconstruction. Detective, have you considered that these might not be real patients at all? This was a perspective I hadn't considered. What do you mean? These could be fabricated identities created for the purpose of obtaining medical treatments or accessing controlled substances. Someone might be using advanced technology to create multiple versions of the same fake person. Dr. Webb, who would have the technical ability to create such sophisticated false identities? Someone with access to medical databases, digital imaging technology, and detailed knowledge of how patient records are created and stored. Someone like a medical technician or database administrator? Exactly. Detective, I think you should investigate the technical staff at the clinics where these patients were allegedly treated. Dr. Webb's suggestion made sense. Creating fake medical records would require someone with inside access to medical computer systems. I began investigating the technical staff at all 5 clinics where the identical patients had been treated. What I found led me to Rebecca Chin, a medical records technician who had worked at all 5 facilities over the past 2 years. Rebecca Chin was a woman in her late 20s with a background in computer science and medical administration. She had access to patient databases at multiple clinics through her work with a medical records management company. When I interviewed Rebecca at her office, She seemed nervous but tried to maintain a professional demeanor. Chen, I'm investigating some irregularities in medical records at several clinics where you've worked. What kind of irregularities? I showed her the 5 identical patient files. These 5 men were all treated on the same day at different clinics. Do you have any idea how this could have happened? Rebecca studied the files carefully. Detective, this looks like a database error. Sometimes patient photos can get duplicated or assigned to the wrong records. But these aren't just duplicated photos. These are 5 complete medical histories with identical faces but different names and addresses. I don't know how to explain that. Chen, your job gives you access to medical records at multiple facilities. Would it be possible for someone in your position to create fake patient identities? She was quiet for a long time. Theoretically, yes. But it would be illegal and unethical. I'm not asking whether it's legal. I'm asking whether it's possible. Someone with administrative access could create patient records, generate ID numbers, and even upload photographs. But detective, why would anyone want to do that? That's what I'm trying to figure out. I spent the next day investigating Rebecca Chen's background and digital activities. What I discovered was that she had been accessing patient databases outside of her normal work hours and had been creating and modifying records in ways that weren't part of her job responsibilities. But Rebecca was just one piece of the puzzle. I still needed to understand who was behind the fake identities and why they had all sought memory treatment on the same day. The breakthrough came when I traced the insurance information for the 5 fake patients. All 5 policies had been purchased from the same agent, a man named Thomas Mitchell who specialized in temporary medical coverage for people with pre-existing conditions. When I interviewed Thomas Mitchell, he provided me with information that cracked the case wide open. Detective, those 5 insurance policies were all purchased by the same person, but I never met him in person. All communication was through email and phone calls. Did you get a name? He called himself John Stevens, but the payments came from a corporate account belonging to Neurological Solutions Incorporated. Neurological Solutions Incorporated, the same pharmaceutical company that had been funding Dr. Hansen's research. I immediately obtained a warrant to search the offices of Neurological Solutions Inc. What we found there revealed the full scope of the conspiracy. The company had been conducting illegal human experiments using fake patient identities to test memory-altering drugs without proper oversight or consent. They had been paying Rebecca Chen to create false medical records and Dr. Hansen to administer experimental treatments. But the most shocking discovery was in the company's research files. They had been testing a technique called identity reconstruction that could completely erase a person's memory and personality, then implant new memories to create what was essentially a different person in the same body. The 5 identical patients were actually test subjects who had undergone multiple identity reconstruction procedures. Each time, their memories were erased and replaced with new ones, creating different personalities in the same physical body. Detective Carter, said Rebecca Chen when she finally confessed, I thought I was just helping with medical research. I didn't realize they were erasing people's entire lives. How many people were involved in these experiments? At least a dozen, maybe more. They would bring in homeless people or patients with severe mental illness, people who wouldn't be missed if they disappeared. And Dr. Hansen was performing the memory reconstruction? She was the lead researcher. She believed she could cure mental illness by completely replacing damaged minds with healthy, artificially created personalities. What happened to the test subjects? I don't know. After the procedures, they were moved to a private facility outside the city. I was told they were being monitored for side effects. The private facility was an abandoned psychiatric hospital that Neurological Solutions Incorporated had purchased 3 years earlier. When we raided the facility, we found 12 people who had undergone identity reconstruction procedures. These individuals had no memory of their previous lives. They had been given new names, new personalities, and new memories that had been artificially implanted by Dr. Hansen's team. They believed they were voluntary patients recovering from various medical conditions, but they were actually the victims of unauthorized human experimentation. Dr. Patricia Hansen was arrested and charged with medical malpractice, fraud, and conducting illegal human experiments. Rebecca Chen was charged with fraud and conspiracy for her role in creating fake medical records. The executives at Neurological Solutions Incorporated were charged with multiple federal crimes related to illegal drug testing and human trafficking. But the most tragic aspect of the case was that the 12 victims could never fully recover their original identities. The memory reconstruction process had been so thorough that their previous personalities were essentially destroyed. Detective, said Dr. Sarah Mitchell when the case was closed. This investigation has changed how I think about the nature of human identity. If memories can be completely erased and replaced, what makes us who we really are? It was a question I couldn't answer. The case of the memory thief had shown me that the human mind was more fragile and manipulable than I had ever imagined. The 5 identical patients in the medical photos had all been the same person. A homeless man named William Parker who had been subjected to multiple identity reconstruction procedures as part of Dr. Hansen's research. Each time his memory was erased, he became a different person with a different name, but his face remained the same. William Parker's original personality was gone forever, replaced by fragments of artificially created identities that bore no resemblance to who he had been before the experiments began. The case taught me that in an age of advanced medical technology, the line between healing and harming can become dangerously blurred. Dr. Hansen had convinced herself that she was helping people by erasing their traumatic memories, but she was actually destroying the very essence of what made them human. Every case tells a story, and the story of the memory thief was about the fundamental importance of our memories in defining who we are. Even our worst experiences, our most painful memories, are part of what makes us unique individuals. When someone steals your possessions, you can replace them. When someone steals your money, you can earn more. But when someone steals your memories, they steal your identity, your personality, and your entire sense of self. The victims of Dr. Hansen's experiments would spend the rest of their lives trying to figure out who they really were, knowing that their true selves had been erased forever by someone who claimed to be helping them. In the end, the most valuable thing we possess isn't money or property, it's the collection of memories that make us who we are. And that's something that, once stolen, can never truly be recovered.